All right, I'm just going to go over your general elbow arthroscopy discharge instructions. We're just going to walk through these instructions. You'll notice at the beginning we've got the office phone number and the office hours, but we also have my personal cell phone number. So if it's evenings or after hours and you're having a question, or you just want me to shoot me a text question or some video or pictures of something you're uncertain, there's my cell phone number. So for the first 2 to 4 weeks, and we'll kind of judge this based on how we're doing at the 2-week recheck, I want us to limit activity to leash walks only. So no running, no jumping, no rough play. And then on the leash walks, I want them to be about 5 minutes, 2 to 4 times a day. On these walks, I want us to be going so slow that they're forced to use the leg. So the slower we walk, the more off balance they are, they'll be forced to use their leg. So the walks are very important to getting that elbow moving. In addition, I'm going to have you doing some passive range of motion exercises for the elbow. 2 to 3 times a day for about 10 to 15 repetitions, where we're maximizing flexion and maximizing extension of that elbow. All right. And then we're also going to want you to ice the elbow for the first 3 days. After 3 days, you can stop the icing, but let's ice it before we do the exercises for about 5 to 10 minutes, however much they'll allow you to do. There are 2 little incisions right on the inside of the elbow, each with a suture. All right, just check those out daily. Make sure there's no fluid or discharge draining out of them. If you've got an issue or you're nervous about it, take a picture, send me a text. We do send her home with a cone so she's not licking on that. Those medial port incisions, that's what those are. Medication-wise, we've got 2 coming home. We've got carprofen or Rimadyl. We're going to give that every 12 hours for discomfort and inflammation. We do things on a 6 a.m. and 6 p.m. schedule here. So we're due for medications at 6 p.m. Give the carprofen with a little bit of food. Gabapentin, it's going to help with discomfort as well, and we're going to give 1 capsule every 8 to 12 hours, okay? And you can do that, not a hard 8. I like to call it an easy 8 if you think she needs it on an 8-hour schedule, morning, after work, before you go to bed. Here in the hospital, we do it every 12, again, 6 and 6. But if you think she needs a little bit more when you get home, you can switch the gabapentin to every 8. And then we just need to set up a recheck in 2 weeks so that I can feel her elbow, see how she's using her leg, and we'll start modifying activity at that point.